Function with Purpose podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to Season 12, Episode 1 of the Function with Purpose podcast. We are digging into this season right off the bat. Doing your own research. If this is your first time hopping on this podcast, I am Dr. Amy, your host and owner of Fortress Physical Therapy. I am located in the South Charlotte, North Carolina area in Pineville, North Carolina. But thank you. I appreciate you stumbling across this podcast. Season 12. Wow. Hopefully those who do stumble upon this podcast can take little nuggets from each. So this first episode of Season 12, doing your own research. What does this mean? What do you mean by this, Dr. Amy? Well, here's what I mean, because as per usual, these topics I kind of get sparked when I'm interacting with patients. And this one was awesome. And I think it literally does come down to the patient or the client themselves in doing their own research to benefit them. So there's kind of this realm that, you go, perhaps you get your physical every year, which we probably should. You go to your primary care physician, and then if something kind of looks a little abnormal, perhaps there might be a marker in your blood work that you get that day. That physician or primary care physician, healthcare provider will refer out, right? So by meaning refer out is they will look within their system and refer to a doctor that kind of specializes in hematology, right? If you're getting blood, there's usually a hematologist around that might specialize in a specific blood marker. So you kind of just get put into this area that whatever your primary care doctor recommends, that is automatically the way to go. I do beg to differ, especially in the case of physical therapy, which is the profession that I do. I think it is important for the patient themselves to do their own research when it comes to their musculoskeletal health. Referral from a previous healthcare provider or perhaps a primary care physician is one thing, but then on the flip side, from the physical therapy point of view, referral to and from a physical therapist is another realm. But today I do want to share a quick little story and just my 2 cents on the importance of doing your own research when it comes to health, wellness, fitness, recovery, and specifically musculoskeletal orthopedic concerns or issues, because that's what I specialize in. So this patient of mine has been experiencing unfortunately, a decrease in function orthopaedically, meaning her one shoulder has extreme limited range of motion. It's very hard for her to lift the arm above the head, out to the side, and even behind her to scratch her back. And over time, she still maintained her fitness. She trained around the loss of range of motion. She still made fitness a part of her life, but In all, she's been to multiple orthopedists, and now to the point where she is going to elect to get shoulder surgery. In this specific surgery, she is going to get her shoulder joint replaced. So she has been spending a lot of research on her own, spending the time to research surrounding orthopedic surgeons in the area that specialize in shoulder replacement therapy or shoulder replacement surgery, And she has done her due diligence to quote unquote interview the providers that she was seeking and researching. And I think that interviewing providers or these surgeons that she might elect to say, hey, yes, I do want you to do my surgery, is very important for her case. Because she is very knowledgeable. She's also has her list of questions that are very appropriate to what to expect going into a surgery and what to expect coming out of the surgery, how the surgery is performed, and what type of implant is used in the surgery. So she's educating herself along the way, as well as researching that individual and asking appropriate questions to that individual or surgeon that, hey, like, how confident are you? You know, this is a big deal for me, and I'm very independent, and I know at this moment it's going to make me dependent on other people to help me if I do get this surgery. So, first and foremost, when I initially started working with this patient, she was telling me her background and what just happened, and, you know, the type of surgery that she was considering, which was a stemless total shoulder arthroplasty. So that's becoming more solidified in the research that there's quite limited lifting restrictions. So there's not as much limit to lifting restrictions when it comes to a shoulder replacement. So she wanted to tie in my help within that process. And this was an athlete. She's older. And I would see her basically every other day at the gym, and we would cross paths, and from time to time we would interact, and she just felt, and I also felt, this connection with her that I am happy to be interviewed by her to be a part of her routine. So we made an instant connection, and yeah, she most likely researched me, and it's very important to do that on your end. No matter if you're prepping for an extensive surgery, and even if you are literally developing your healthcare team of professionals to better serve your goals or your purpose, right? Each individual healthcare provider, i.e., primary care physician, physiotherapist, massage therapist, maybe registered dietitian, maybe a sports chiropractor, maybe your fitness coach in your fitness classes that you take, all the way to, in this case, the orthopedic surgeon that is going to do surgery on your shoulder. Having this circle of healthcare providers is very important. Because as the patient, right, like, you're putting your trust into these people, and these people also have to understand from the patient perspective on the expectation, right? So interviewing as the patient, being the interviewer, is important. It's not a bad thing to quote unquote interview people. Now, flipping back to my patient's story, we actually, when her and I initially consulted with each other. Like, we actually did set up a Zoom call because our schedules were a little bit crazy. So we got on an actual Zoom call and we're literally interviewing each other. So there were moments too that when she would contact these orthopedic surgeons' offices, she actually did set up a Zoom call with the surgeon, and that's very rare, especially from that orthopedic surgical route. Like, you usually have to go in person and set up a visit. So she was able to finagle some of those Zoom interviews because some orthopedic surgeons that she was researching were out of state. So they were not located in North Carolina. So she was definitely doing her due diligence to really find that person who had the expertise, had the confidence, was able to explain things in layman's terms, preoperative, post-operative expectations, etc. And doing your own research is super important no matter the scenario that you're in. So there's nothing wrong with this. From the physical therapy, me being the physical therapist and me seeing and working with patients, I've experienced working with a patient only one time, and then that patient just straight up left. Like, they just ghosted me. I would try to follow up via phone call, email, text message, and there was nothing. No response. Absolutely nothing. So, I felt like I did a good job on the initial evaluation in person, but, maybe something happened or they felt like they didn't connect with me. As a provider, sometimes you can't chase after that because you're not for everybody. And then on the flip side, I've had patients that are super connected to my why and understand the importance of health, wellness, fitness, and recovery, and blending that together, and that when an injury or a setback happens, that they understand the importance of training around that issue. Or perhaps they may seek out my help and say, hey, Dr. Amy, is this something that I should, maybe get a referral to or from or seek help elsewhere? And it's kind of cool to be in that position and be asked those questions, be interviewed those questions. And man, it's just super empowering, not only from the provider's point of view because they trust you, but also from the patient point of view. Because I know that patient is about it. That patient always wants to strive for the better, always wants to strive for more, that they want to move their sailing from point A to a higher point B, right? They don't want to be stagnant. They want to stay up to date on research on providers. They want to stay up to date even on current research, legit research that physios probably study and read up on. And that's just super important to taking care of your health span and lifespan. So I don't think there's anything personally wrong with legitimately interviewing potential providers who make up your healthcare routine. It is important that when you do your research, that I know AI is becoming a thing, artificial intelligence, and that can help, and even Chat GPT, but that's not really like research. I think research is, if I were to research a provider I kind of want to know their background, how much schooling they went through, the location of the clinic, what do they like to do for fun, putting a photo to a name or a name to a photo. I just kind of get the feel of, the actual presentation of the provider, right? Not to bias anything, but, acting the part. There's one thing to say you're going to do something, and then there's another thing that you're actually doing the something. I think that's important that your provider says what they do and does what they say. And also, even contacting the office or the provider themselves and doing your mini interview and asking the questions. Because when it comes down to it, the baton is in the patient's hand. So when something happens, whether it's an emergency or non-emergency, it is up to you, the patient, to set yourself up for success, to get the benefit of who's going to help you or who you think's going to help you. So don't poo-poo interviewing providers, but also don't over-interview, right? Like, it's kind of like if someone over-interviews other healthcare providers, it's almost similar to when people come into the gym or to the CrossFit space and they're like, there's like this secret term called box hopping, where newbies might come into like one CrossFit box and then stay there for a week, and then they're like, oh, I don't like this, and they just ghost to that gym, and then they go to another one and they stay there for maybe a couple of days, and they're like, oh, I don't like this, and then they go to another CrossFit box, and then they're like, nope, this isn't for me. Or they might just take a free trial class and like never show back up or follow through, or just close the chapter. They just keep hopping around from like CrossFit gym to CrossFit gym, or Crunch Fitness to Planet Fitness to YMCA, etc. Patients do that. When patients seek healthcare advice or evaluations, that's totally a thing. And there's a moment where over-interviewing providers will outweigh true interviewing of providers. So there is kind of like a imaginary division line, per se, that if you are a provider hopper, you're probably not doing the appropriate research that you need to be doing, or should be doing. So it's that moment that you are or should realize that you're doing yourself a disservice. So maybe if you are provider hopping, maybe one provider that you really connect with is that outlet. Like that provider knows the other connections that need to be made in order for you to prevent going down like that rabbit hole of provider hopping. That's probably like a whole nother topic, but in all, that research wasn't done appropriately on your end. Now, this is my opinion. Don't forget, side note, all of these podcasts are my opinions and personal stories that I'm sharing. So there's no right and wrong way, but just something to get you thinking differently, and myself differently. So doing your own research is definitely a part of the process of continuing to expand your health span and lifespan, which then dumps into kind of my four or so buckets of health, wellness, fitness, and recovery. And that is super important in order to maintain longevity. And it's a part of the process of continuing to get yourself better, to look better, feel better, do better, move better, and of course, function better. So doing your own research, for whatever the case may be, is a thing. And there is a difference, and there's a line between interviewing the potential providers that can be a part of your team and over-interviewing providers. And doing the appropriate research. So this is huge, especially in the scenario I gave earlier of potential orthopedic surgery or a potential musculoskeletal surgery. You have to connect with that person, not with just the surgeon, but your healthcare provider team. You have to have that connection, that why, that need, that understanding. And hopefully, at some moment, if you're listening to this or if you're in the Charlotte, North Carolina area, I can be that provider for you and with you. But you can do your own research and feel like that might be the need and I might be a part of your circle. Anywho, all right. So, doing your own research. There's nothing wrong with interviewing providers and gathering the data that you need in order to fulfill your expectations and connecting with that person. There's many healthcare providers within a team, all the way from massage therapists, physiotherapists, occupational therapists, to fitness instructors, all the way to nutrition coaches, primary care physicians, nurse practitioners, etc. And it's all about collecting the data, keeping the research on top of things, and you staying up to date on things as well, and knowing when it's time to either add or subtract someone from your team. And it's okay to do that. But understand that also, interviewing potential providers and over-interviewing providers or provider hopping, there is kind of like this imaginary line that I believe is separating the two. So knowing when to get that referral out, or knowing when to subtract someone from your healthcare team, etc. But it's very important to do your own research so that you can build the team that you need for you. That's a wrap for today's episode, Function with Purpose Podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.